Now it is my pleasure to introduce you to Simon Habegger, who will be joining us virtually. Simon Habegger graduated with a Bachelor of Arts in Anthropology and a Master of Arts in Biological Anthropology and has used both these degrees, biological and social-cultural aspects, for his work. He spent several years working at a rural nonprofit in Southeast Asia and taught human anatomy in a nursing program in Micronesia. He went back to school to study public health and has since worked in health promotion and program coordination for HIV Edmonton, Diabetes Canada, and Alberta Health Services. He currently is the program coordinator for the Population Health Initiative, Do Bugs Need Drugs, which promotes community health education on appropriate antibiotic use. He is joining us virtually today to tell us about this initiative. Mr. Habegger, you have the floor.
Thank you very much for that welcome. I'm very grateful to bioMérieux for the chance to speak here. And my talk is quite simple. I'm simply here to share some information about local resources that we've developed here and our experience using them in education around antimicrobial resistance and the proper use of antibiotics. And so just for background, I'm the coordinator of Do Bugs Need Drugs, which is a community education program that began in Grand Prairie, Alberta, around 26 years ago. It was a nonprofit for many years, and it was taken up by AHS in around 2012, 2013. And now it's based in Primary Care, Alberta. It's part of the CDC, and it's a community AMS program that supports the over-the-counter management of common infections when appropriate, hand washing, and the proper use of antibiotics. Our website is, I hope you can see, is dobugsneeddrugs.org. And our three main areas of focus are infection prevention, which generally means hand washing education, the guide to wise use of antibiotics for common upper respiratory tract infections, and then specialized support for primary care prescribers, which is primarily Bugs and Drugs, a prescribing guide for Western Canada. And if you look at our website, dobugsneeddrugs.org, you can see the division of these three resources, and then along the top bar, a few other general things that we have. So I'm just going to mention hand washing very briefly here. We have a variety of resources around hand washing that have been developed over the course of our 26-year history, some for daycares, some for elementary schools, and some for nurses or student nurses who do community health outreach within schools. These consist of, at their most simple, just hand washing posters, which we supply in English, French, 4 of the indigenous languages of Alberta, and Plautdietsch, the language of the Low German Mennonite community. We have things like activities for grade 2, grade 3, first grade students that teach them about hand washing and proper disease management. But our most complex resource is the Guide to Wise Use of Antibiotics, which covers hand washing, antibiotic resistance, the management of 7 common upper respiratory tract infections, and how to recognize emergency symptoms. It's fully online. During the pandemic, when many of the public gatherings or public groups where we would distribute this ceased to happen, we went fully online. And so we started producing QR code magnets that let people keep the resource stuck to their fridge and then access it when they begin to feel ill or their children are ill. And it has 3 primary goals. The first one is home management over a clinic visit. If people don't need to go to clinics, we definitely prefer that. The second is non-medical management the second is when people go to the doctor, that they're able to have effective conversations with their healthcare providers about whether antibiotics are needed or not, and hopefully that they go there without the goal of getting antibiotics from the beginning. And then the third, which is important but often neglected, is improved patient satisfaction. Since if people feel that they need antibiotics and they don't get them, that can often result in a feeling of substandard care and trying to find ways to get antibiotics in the future or in a different venue. Anyway, this is what it looks like. Um, the Guide to Wise Use is it's divided into 12 main sections, of which 10 appear in the table of contents, and then the final two are at the very bottom. It was organized like this to keep somewhat minimized the amount of information that appears on the menu. And it discusses antibiotic resistance. And then for all of these different maladies here, how to manage them at home and the chances that you might actually need antibiotics, what the sort of decision tree is for discussing with your doctor. And then at the bottom here is an example of one of the initiatives that we've taken with it. This was also during the pandemic when we were developing digital resources and unable to get out into the community. We translated it into many languages of communities here in Alberta. The two here that are shown are screenshots of the Tagalog and the Chinese version. And so the uses of the guide are the best outcomes with necessary antibiotic use, improve public knowledge, improve patient satisfaction. And what you see here are examples of the different QR code magnets for the English version, for the syllabic Cree version, for the Somali version, for the Tigrinya version. We've translated it into many languages, but we have an emphasis on those of more recent refugee communities, since those are ones where they may be coming from a different medical culture and have different expectations for antibiotic use, and at the same time are made up of people who didn't plan on coming here to Canada. And so here are just a few of the lessons we've learned in the last couple of years in distributing this type of knowledge. That just giving people the magnets randomly is ineffective. For myself, I find health information attractive and fascinating, but most people don't. And so when we look at our usage stats, we see increased usage mostly after events where we have time to discuss it briefly with recipients to be specific, tell them what it's for and how to use it. Put it on the fridge, read it when your kids get sick. It's to help you decide if you need to go to a clinic. You need to give these out in venues where people have a chance to hear this message. Social media networks have been very helpful to us, but they're also difficult to get access to. Not everyone is excited at the chance to advertise something on the proper use of antibiotics. And I suspect that many groups try to get social media networks to advertise them. And finally, there's always the dream that you'll find some way to reach people easily and simply, but it never quite happens. And so I've always thought that if I was living abroad and someone had developed health information, particularly in my language, I would take that and look at it. But it's not actually the case. You need to give it to people when they're actually thinking about health and looking for information on it. Um, Certain of the translations get substantial use, both within Canada and worldwide. Examples of these are Tagalog, Bengali, Urdu, traditional Chinese, Romanian, Albanian, Plautdic, Cree, Amharic, and Oromo. And then at the same time, other often larger languages don't. So, for example, the usage of a small language like Albanian um, equals in a single month often equals the usage of Arabic or Hindi or Spanish over a year. Why this is, I've never quite been able to figure out. But the real reason I'm here is that our program is based in Alberta. We focus on Alberta communities. And yet, when you think about it, having a program that would defeat antibiotic resistance within Alberta is impossible. It's a worldwide problem caused by communal spread. And so unlike, for example, a program that is meant to vaccinate everyone in Alberta or notifiable diseases in Alberta, the actual problem we deal with extends beyond our borders. And so all of these resources have been published under a Creative Commons license, which would permit their sharing, adaptation, and usage by anyone, anywhere in the world, under some conditions that are stated clearly. And that is essentially what I came to say. If anyone has any quick questions, I'd be happy to answer them. And according to the timer, I have about 25 seconds left. So thank you very much for your time. I'm grateful for your attention. And it would make me happy if these resources would be useful elsewhere in Canada or the world.
Thank you so much, Simon. Thank you. I think we will direct everybody to contact Simon. He's got his contact information up there and he can be reached, and hopefully people can connect with him for these resources. Thanks so much, Simon, for your time today.
Thank you very much. I appreciate it.
Thanks.